This is Health Call Online, a place where you hear extended versions of interviews featured in our weekly radio broadcast, the Health Call Radio Hour, heard on more stations around the country as they join the Health Call Radio Network. Our focus today is medical tourism, going overseas for medical procedures. Sometimes you're going to be able to save a significant amount of money. That's the primary driver, but of course, that raises lots of questions. What about the quality of care? What happens if something goes wrong? And what procedures is this a good idea for? Well, I reached out to find out more about that by talking to Elizabeth Zimba. She is the president of Medical Tourism Training and a regional director for an international healthcare accreditation organization. So, Elizabeth, glad that you are here. Give us a bigger picture on exactly what it is you do. What's the role you play?
Thank you, Lee. Thank you for the opportunity to talk with you and address some questions that your audience may have. As president and founder of Medical Tourism Training, our company, our team offers consulting and training services to healthcare providers, hospitals, and clinics, as well as to governments. Most governments around the world have a national healthcare system, which of course we do not offer in the United States. So many of them are interested in attracting international patients to their destinations. And we focus on improving the quality of their clinical care, the quality of the overall patient experience, while looking at the overall health of their own internal institutions.
So we think of this as Americans traveling overseas, but I know that that's only a small slice of the pie. There are people from countries traveling to other countries all around the world all the time. But of course, our focus is going to be the domestic US markets. So what are the procedures people travel for these days?
By far the most popular procedures or group of procedures globally, and this includes in the United States, is people traveling for dental care. Also very popular would be cosmetic surgeries or cosmetic treatments. Also IVF, as well as what we call bariatric surgery, better known as weight loss surgery. So those are probably four of the top most popular procedures that people around the world and Americans travel for.
So those are all elective, out-of-pocket procedures that insurance isn't going to cover in the United States. That makes sense. Does my health insurance policy, if I have a different type, maybe I want to do an orthopedic implant or something of that nature, does domestic health insurance typically cover that if performed offshore?
Typically not. Usually the types of private health insurance that people have, either through their employers or if they purchase it themselves, those plans typically don't cover procedures outside of the United States. There are a few exceptions to that for individuals who work for self-insured employers, sort of a hybrid system. And of course, if Americans are traveling anywhere outside the United States and they have an accident or need emergency treatment, providers will offer that treatment, but how that is covered varies widely. Often there will be some reimbursement from the U.S. health system, but oftentimes there's also a very large proportion that has to be paid out of pocket.
I don't think Americans understand that overseas there are different tiers, different layers of healthcare, and that when you're traveling for medical tourism reasons, you're in the top tier, the top layer. Can you walk us through that?
Typically, the types of hospitals and clinics that are looking to work with international patients are in the private sector. So most countries have a public sector that's national health care, but there are also some number of private hospitals and clinics. And they have a little bit more freedom in terms of who they can market to, who they can try to attract, the services that they might offer. So these are that would typically be who our clients would be. They're looking to promote their services, to improve their services, promote their services outside of their local destination.
Got it. So this is not the This is not the free health care that other people in that nation might receive. This is a private hospital where they step things up a bit. Uh,
Exactly.
what about quality and safety? I think that's going to be obviously the number one concern.
Yes, it's a very important. It's a very important issue, and of course, it's going to vary from provider to provider and country to country. So this is part of the responsibility of the consumer, of the patient who's considering traveling abroad, to become familiar. First of all, there are different kinds of safety that we talk about. We think about physical safety in terms of traveling to different destinations. Some destinations are safer than others.
Mhm.
And the US Department of State, you can Google any country in the world and you can find a travel advisory who will tell you that, yes, this country is very safe to travel to for personal safety reasons, and other destinations are not. And then of course, there's the issue of patient safety, which
Exactly.
has to do with the quality of healthcare services. So international patients need to think about both kinds of safety. And in terms of safety at particular providers, individuals can certainly ask about, as you might even do with your local provider, how many of these operations or procedures do you do every year? What are your outcomes like? How good are your outcomes? These are questions that could easily be asked and should be asked, and any provider should be willing to give out that information.
Well, typically, what do you see? How many of the outbound cases that you've worked with result in a complication or something that's related to a problem after care?
It's it's an excellent question that I wish I had a great answer to. And I would say one of the shortcomings overall of medical travel is that there's no standardized way to keep this information, and there's no central authority that would collect the data and make it available to consumers. So there's a high degree of trust. There are many things that consumers can do to inform themselves about a particular provider in a particular destination for the kinds of treatments that they want.
We're going to get into some tips for travelers in just a moment, but let me just press this forward a little bit further. So, is my experience when I travel, I know different countries, I'm going to have a different level of support, I guess we'll say. Is it a concierge experience? Am I treated like a high value patient? Am I on my own? Is it a combination? What's my experience? Do they bundle travel and hotel and meals? And is it kind of like going on a medical cruise? Give me an idea of how that works.
Um, there is no one standard type of experience, and it varies widely depending on why the person is traveling, what their own personal motivations are, the kinds of services that they're going to receive, how complex is the medical care that they are looking to receive outside the U.S., and the particular provider that they work with. So I look at it in terms of the consumer, the individual saying, am I going to do this myself, sort of a DIY medical travel experience, or am I going to work with either an individual that we would call, the terminology is a facilitator, or a medical travel coordinator, who's an individual or an individual company, that this is the service they provide. They are sort of a matchmaking business between prospective patients and selected providers. And they may offer bundled services, and by that I mean a package where they will include hotel. They may pick you up at the airport when you arrive, take you to your hotel, ensure that you travel safely between your hotel and the hospital or clinic where you'll receive your treatment. They'll take you back to the airport when you're ready to leave. And there may be some additional services that they offer as well. Some people prefer to do it themselves. And I think for surgeries that aren't particularly complicated, that is probably all right to try to do it DIY. But certainly for complex care, and by that I'm talking about very complicated medical treatments for individuals who probably present with several medical issues. So it may be somebody who's seeking cancer treatment, but they also have high blood pressure, or they have diabetes or some other medical complication. Those kinds of providers that are providing complex medical care will almost always offer end-to-end services. They want to make sure that an individual who's in poor health anyway, and now is traveling specifically for complex treatment, the journey itself is a risk that needs to be managed and is part of patient safety. Patient safety doesn't begin when the individual steps into the hospital or to the clinic. It starts from the first conversation to protect their data, their confidential information, helping them get to a destination safely. And logistically, that can be quite complicated depending on their health profile. So there's no one size fits all. It really depends on why the person is traveling, how complex the medical procedure it is. And I would say as your medical needs increase in their complexity, working with either a medical travel coordinator as an independent source, or working with many providers have international patient departments, especially the providers who offer these complex treatments. So they have people in-house who help to manage all of these different issues.
Well, let me get back to that issue of quality of care and safety. So you've seen, I'm sure over the years, thousands of travel circumstances, people heading overseas for care. Generally, what have you seen? Are the outcomes good? Are issues handled well? Am I putting my health at risk?
Again, there's no one answer to that, but I would say that for individuals who are traveling for high complexity treatments, for cancer, for neurology, spinal surgery, anything terribly complex, the outcomes are generally very, very good. There's high satisfaction and things go well. More of the problems that I see are among the elective procedures that I mentioned initially, particularly around dental care and bariatric surgery, and somewhat around cosmetic surgery as well. These are the arenas where there's more DIY, depending on the destination where the individual selects to travel. There may or may not be regulation in terms of who can treat international patients. There may be licensing and registration issues around the providers themselves, licensure of hospitals, licensure of clinics, licensure of doctors, nurses, other healthcare professionals. So I would say the less intermediated the services are, the more likely it is that a consumer can just pick the wrong provider, not ask the right questions, not do enough homework, and just treat it like it's a holiday with some medical on the side. While, of course, anything that has to do with your health, anything that's medical, where somebody's going to be doing something to your physical being, the emphasis is around the medical and really not around the tourism.
Sure. So if I wanted to jet off and have a little nip and tuck here and there, or maybe a hair transplant, I'm probably going to, those are the areas where you think I'm going to face the more likelihood of a challenge. Is that what I heard you say?
I believe that's true. Again, there's no official collector of these statistics. This is more just from 20 years of working in the industry of what's going on. And it's a rather small group of people who are involved in these niche services. So everybody knows everybody and we hear what goes on. So yes, even for, a nip and tuck is still surgery, and there's recovery, there's the chance of infection, there are all kinds of things that need to be taken seriously. And I think having a medical travel coordinator work with you, or working with a hospital or clinic that has an international patient department, your chances of selecting a good provider go up, because both the facilitator and the provider itself with international patient departments, they will have standards and protocols in place. Facilitators will screen hospitals and clinics for you according to their requirements for those providers to join their networks and be willing to receive their customers.
Makes all the sense in the world. So if I am thinking about this, walk me through a checklist. What should I be thinking about as a consumer exploring the possibilities?
I have a whole checklist of recommendations, even though this is not the focus of our business. As I mentioned, we're a business-to-business consulting and training company, but over the years, I get asked this question all the time. So first and foremost, as you would going to the United States to your local primary care physician or going to your local hospital for care, you should be an educated consumer. You should be doing your research about the provider, the hospital or clinic itself, and whoever the doctor or medical professional will be working with you. What is their reputation? There's so much good information, reliable sources on the internet that doing research is just number one. And to not be afraid to ask questions. For international patients, having a teleconsultation with the doctor who's going to be giving you your treatment or performing the surgery is an absolute must. If you can't arrange that, look for somewhere else to go. You want to ensure that there's clear communication with your doctor, not only because of what may be language differences. So, for example, Americans traveling to Mexico and Americans may not speak Spanish, but the doctor hopefully is at least bilingual. How good is that communication? Is the doctor willing to answer your questions, telling you information? What's the surgery like? What's the recovery period like? How long do you, what medications you'll have, how long you need to stay in country, what's the follow-up? You would ask those questions of your local doctor. Absolutely ask if you're going to be traveling for care. So that's certainly number one. As I mentioned, the teleconsultation. The estimate of costs. This is a big issue, and people automatically assume that traveling for care is going to be cheaper or less expensive is what I prefer. We hope it's not cheaper, because if it's cheaper, that means that costs or corners are being cut that shouldn't be cut. You should also be aware that in some destinations, many destinations, hospitals bill and doctors bill separately. So you want to make sure that you understand all the costs of your medical care, and also do some calculations of your own of how much does it cost to get there? How much does it cost to stay there? How much will it cost to eat while I'm there? How much will it cost me to get from the hospital to the hotel to a restaurant? and so on. And most medical travelers will have someone accompany them, which is an excellent idea. Going by yourself for any kind of medical treatment, if something should happen, you could get in an accident on the way to the hospital. So who's there to make decisions for you, help you think clearly, calm you, have someone there to reassure you, to ask good questions on your behalf. You need to factor in those costs as well. And then make a decision about, are you traveling because you just want to save money, but are you also looking for faster service? Are you looking for higher quality than what's available in your local destination? So there are different factors. It's really, why are you doing what you're doing? And being a smart consumer about how to acquire what it is that you want.
That is great advice, all of that. So what do you see changing in the next few years? Is this a trend that's on the upswing?
Oh, absolutely. And it may not be for the reasons that people think about. We often, as individuals, how often do you think about demographics, global demographics in your daily life? Most people, not very often. For me, it's a regular thing.
Yeah.
So what we're seeing globally is that the last 20, 25 years, we've seen an increase of the middle class in countries with large populations. So, for example, in India, in the last 20 years, the middle class has grown to a size that's the entire population of the United States.
Wow.
And as you have a growing middle class, you have people who can afford to travel, who want to access, they want to take better care of themselves. They may opt for things like cosmetic surgery, or if they want weight loss surgery, other things like that. That may not be medically necessary, but we want them. So globally, there's growing demand. And I don't see that changing at all. In fact, what I have seen in the 20 years I've been doing this is that healthcare providers have been trying to catch up with consumer demand and what consumers want. They want better, they want faster, they want higher quality, they want innovation, they want an excellent overall experience from the initial website visit all the way to when they return home and someone calls to say, how was it? Did everything go well for you?
Wow. A lot to think about as I think about maybe a procedure or two. We'll see how that goes.
I don't know why you would think about that.
You're very kind. All right, Elizabeth, thank you so much for sharing your expertise. I'll have links to your resources and others as well in the show notes. Glad that you were here today. Thanks.
Thank you very much, Lee. It's a pleasure.